In this video, we'll walk through what the Bristle Test analyzes and the different types of outputs you'll see within the test results that give a measurement of one's oral microbiome health and can help guide the optimal care plan. So let's start with, what does the Bristle Test measure? The Bristle Test identifies and quantifies all of the bacterial and fungal species that are found in an individual's mouth. This is done by using a technology called shotgun metagenomic sequencing, which analyzes the DNA of every single microbe that is present within a saliva sample, giving an overview of the complete microbiome. Tests that use older sequencing technologies like qPCR can only detect a handful of bacteria. For example, they may only measure 5 bacteria related to cavities or 10 bacteria related to periodontal disease. But with a single bristle saliva test, you receive a full analysis of all 700 plus bacteria and fungi that are found in the mouth, which gives a comprehensive view into an individual's oral microbiome and the status of their health. Next, let's take a look at the types of outputs you'll see on a Bristle report. There are 2 main types of metrics or data outputs that you'll find in a Bristle report. There are individual microbe scores as well as aggregate condition scores, and we'll dive into both of these. The individual microbe scores quantify the levels of a microbe in a patient's sample. The report includes both the relative abundance as well as the percentile abundance for each microbe. The relative abundance measures how much a species contributes to the overall composition of an individual's oral microbiome. So, take for example, a score of 2.9 for strep mutans means that 2.9% of the patient's oral microbiome is comprised of strep mutans. So, if you add together the relative abundance of all of the species that are detected within a given patient sample, you get 100%. The relative abundance of each species detected is found within the raw results section of the report. However, the relative abundance is not always very helpful. Take, for example, the distribution of a species like P. gingivalis being somewhere between 0 to 0.3% across all patients. But then the distribution of a species like strep mutans being between 1 to 30%. If you saw P. gingivalis at 0.3% and strep mutans at 2%, you might think that the P. gingivalis is very low and the strep mutans is very high in this patient sample, when in fact the opposite is true. To account for this, the relative abundance of each species is normalized on a scale of 1 to 10, and it's reflected as a percentile abundance. The percentile abundance represents the relative amount of a microbe in a given patient's sample compared to all other samples. This gives a better representation of a microbe being high or low in a patient compared to what is normal. So, for example, a 9.5 for the patient's percentile abundance indicates that that species is greater in this patient sample than 95% of all other patient samples. The percentile abundance is the most common metric used throughout the Bristle Test report. So you'll find it in places like the key bacterial species chart, the detailed results, as well as the raw results. Next, let's take a look at the aggregate condition scores. The aggregate condition scores are calculated using Bristle's proprietary algorithm, which sums up the relative amount of each microbial species associated with that given condition. The score, which is out of 10, represents the probability or risk of the patient having that respective condition. For example, a score of 4.7 out of 10 represents a 47% chance the patient has the condition and can inform the prognosis, or how likely, without any interventions, the condition will progress. There are 3 primary oral health scores: beneficial bacteria, gum inflammation, and tooth decay. And then there are 4 additional health and wellness scores for halitosis, gut impact, nitric oxide, and diversity. Each score is comprised of different sets of bacteria. For example, the gum inflammation score is an aggregate of 18 different species of bacteria that cause periodontal disease, whereas the tooth decay score is an aggregate of 19 different species that cause caries. Tooth decay and gum inflammation are categorized as optimal, average, needs improvement, at risk, or high risk, whereas the beneficial bacteria, gut impact, halitosis, and nitric oxide scores are categorized as optimal, average, or needs improvement. Lastly, the diversity score has categorizations for too low, too high, or within range. Too low or too high may signify elevated risk of infection, but the vast majority of patients are within range where no action is needed.